Hey, I'm Dr. Paul Dyer. How you doing? We're going to be talking about one of the nerves that I think plays a bigger part in our lives. It's called the vagus nerve. Without getting into the weeds of what the vagus nerve does with all the things it does, I think I can teach you the technique to help you calm the vagus nerve. The vagus nerve, we know, touches a lot of our organs, and it's a big communicating highway between our heads and our lower part of our stomach. Now, I'm going to bring up a picture here to help you see what the vagus nerve is. You can see it's this yellow part right here, and it goes into the back, the base of the skull. What happens is that you've noticed the vagus nerve before. If you've never heard it before, it talks about our second stomach, and that's where our brain comes in. If you're nervous, anxious, or depressed, your stomach comes into a sickness. Some people get what you call butterflies or uneasy stomachs or tightness. Well, that's that vagus nerve overstimulating. Okay, here's a breathing technique that works of calming that vagus nerve. I teach breathing techniques all the time because I really believe breathing is the source of life. As you know, if you're not breathing, you're dying. Okay, but here, when you know that your body is reacting to the environment, to an emotion, to other past education that's been false, your vagus nerve is the one that's triggering that. And we've talked about the brain before, about the amygdala and how it can create all this havoc. So what's the breathing technique? First, let's see that vagus nerve. You do your own study about what the vagus nerve does and doesn't do. And I'm going to bring up another picture here that shows you where that stems from. So we know it's the longest vein in the body and it touches all the major nerves. Breathing technique for the vagus nerve. We know that we breathe in through our nose and out through our mouth on a regular basis. Okay? We know that our belly expands when we breathe in and the belly contracts as we blow out. If you're not doing that, you're actually not doing what you call normal breathing. Okay? So work on that. This breathing technique stays in our nose. We breathe in, belly expands, blow out, belly contracts. Breathe in, belly contracts, blow out, belly expands. Okay? So it's that technique, alternating that pattern, helps relax that vagus nerve. So that uneasiness, that stagnant feeling in your stomach, that tension, stop doing all in here, getting all those headaches. A lot of this is called from overstimulation of the nerve activity. If you can relax the longest nerve in your body, that will help you on the way of being a little bit more happier. Okay? Practice this technique. If you have any problems, you contact me. We need to work on the living art sciences. This is part of that. Thank you. Namaste.